So a stroke is when part of the brain is damaged from a lack of blood flow, and there are different causes of that.
During which a person usually identify that as maybe facial drooping or speech difficulty, or maybe even like a vision change, or usually a sudden that's unexpected.
There's a wide variety of symptoms that can caused by stroke, depending on the location. The most common ones are facial weakness on one side, problems with speech, weakness on one side of the body, or loss of sensation or problems with sensation on one side, some sudden onset of imbalance, or problems with coordination.
It really depends on what area of the brain is affected, and so you can have one or multiple symptoms at a time.
There are two main different types of strokes. The first one is ischemic stroke, and the second one is a hemorrhagic stroke. The ischemic stroke is usually much more predominant than hemorrhagic strokes. And the idea is that during a hemorrhagic stroke, in addition to lack of blood supply to the brain, there's also bleeding inside the brain tissue, and which adds a new set of complications in those cases. Luckily now the hemorrhagic strokes are less common. Maybe 20% of the general population who have stroke, they have hemorrhagic strokes, versus 80% that have usually ischemic stroke.
There are a lot of different risk factors for stroke. The most common are things like high blood pressure, diabetes, high cholesterol, heart disease, smoking. Those are all things that we can work on to try to decrease our risk of stroke.
You know, patients who have risk factors to have ischemic stroke, they usually have very similar risk factors to having hemorrhagic stroke. So yes, so if a patient had, let's say, an ischemic stroke one time, they're actually predisposed to having either an ischemic stroke or a hemorrhagic stroke the next time, and they could have, you know, the higher number of strokes they have, the more likely that they could have another stroke in the future.
So there's a lot of things we can do to decrease our risk of stroke. We can work on managing our blood pressure, eating healthy, keeping our cholesterol down. If we're diabetic, we need to work on really tight sugar control. Exercise is really important, healthy diets. If we're a smoker, stopping or cutting back on tobacco is very important as well.
Well, we like to use the acronym BFAST as a way to help us remember the signs and symptoms of stroke and what we do when we see those signs and symptoms. B stands for balance, so is the person having any trouble standing or walking. E is for eyes, is the person having any trouble with vision. F is for face, is there any kind of uneven look to the face or asymmetry to the face. A is for arms, is the person having any numbness or weakness in the arms. S is for speech, is the person having any trouble with speech or language. And T is for time, and so that means to go ahead and call 911 as soon as possible.
Time is of essence. We have a saying, time is brain. Brain tissues and brain cells are quite vulnerable to any lack of oxygen and blood supply, and that's why we only consider this treatment typically within 3 hours from the symptom onset, sometimes with certain exceptions up to 4.5 hours.
There's two ways that we manage stroke patients. Now, if someone is actively having a stroke, it's very important that they come in right away. There are medicines we can give, blood thinners, procedures we can do to try to reverse the stroke that's actively happening. We don't have very long to do that, so the sooner people can get in, the higher their risk of having a good outcome after their stroke. Long-term management usually includes taking blood thinners, possibly cholesterol medications, and working on those risk factors such as high blood pressure, diabetes, to try to decrease the risk.
If you think you're having a stroke, call 911 immediately, because the faster that you can get treatment, the better your chances for recovery.